Hi, everyone. Welcome to the HSC Industry Advisory Council panel discussion. My name is Nikita Rishi. I'm currently a student in the HSC program, and I'm also the president of the HSC Club. I'm going to allow Omni to introduce himself.
I'm Omni Romero. I'm an HSC graduate student. I went to Lehigh for my undergrad as a BioE major. I'm also in the HSC Club, the treasurer. So thank you all for coming today. Hope you all enjoyed lunch. We're going to get started with the questions. We're going to ask the panelists a few questions to start off, and then a little later we'll open the discussion to everyone else.
Okay, so to start off, could the panelists please share their name, their background, what year they graduated, the company they work at?
Hi, everyone. My name is Laura Seeger, and I am a graduate of 2014. I was a Lehigh undergraduate student as well, so I carried right in from my undergraduate into my graduate program. I'm currently working for PricewaterhouseCoopers as a management consultant in health industries. And I've been working with a lot of different healthcare providers, working with them on a lot of organizational change issues.
Great. Hi, everyone. Chris Srinivasan. As a graduate of 2012, one of the first graduates of the program. So as you can see from my gray hair, it's been a while. But I work for a company called CareVive. I'm the VP for product development here. And what we are is a small technology platform company where we're trying to bring oncology survey models to patients and develop survivorship care plans. And what all that means is basically is I'm in charge of developing the product that we're using. I work closely with the software development teams, helping develop requirements and the operational processes that are happening within the company and then at our sites as well.
Hey everyone, my name is Yu Xin, known as Chase. I'm working with Genea as an intern, but functioning as project manager, data analyst, and process improvement specialist. And so I'm class of year 2015, and our company has a main product as data analysis information platform provide to our clients to get them more information. We're looking forward to use data to solve healthcare system issues.
Good afternoon, everybody. My name is Philip Burrell. I am Director of Research, Health Market Research up at HAP, which is the Hospital and Health System Association of Pennsylvania. It's based in Harrisburg. I'm a 2015 grad of HSE as well. And if you want to know a description of what I do, that man in the very back, Mr. Martin Chikichop, is the go-to guy to ask. He is Mr. Everything across the state for research and policy. So I work with him to help hospitals with best practices and anything else in between.
Okay, thank you for the introductions. First real question is, how did your experience in the HSE program prepare you for your prospective careers?
Are we just going down the line? Yeah. Okay. I would say that the HSE prepared me for my career in a couple different ways. I would say the first way is that it really put me in a mindset of looking at different processes, how different processes affect how an organization works. I think that the core courses that we took, having just a general background in healthcare finance, quality and process improvement, having an intro to the healthcare system just really gives you a great foundation going into healthcare, having awareness of so many different aspects of the industry. I think we get great awareness, great exposure, and additionally, I would also touch on my capstone project. I did my capstone project with Lehigh Valley Health Network, and I worked with them on transitioning their primary care settings into patient-centered medical homes. I think that really just being in that setting and seeing that change happen firsthand was really beneficial before going into my career.
This is an interesting one for me. I think coming into the HSC program, I had a really strong medical and healthcare background, but I was lacking a bit on the engineering and the analytical side. So that was one piece that was very beneficial and highly experiential for me. I think the second piece, having been in the program and one of the early adopters of such a program, coming through Lehigh, I think I was able to leverage this type of a degree in the career space or in the professional marketplace. Because a lot of folks didn't know what the actual program was about, what it entailed, what the product of this type of program was, so I can leverage myself in different ways based on my learnings from one of my capstone project, the internships that I had throughout, and also the connections that are in this room that you all probably met during lunch and throughout some of the events that are happening at Lehigh. So those are definitely some of the high points.
We're on question 2.
Already on question 2, Jeremy.
All right.
I didn't introduce myself, though.
Sure. So hi, everyone. I'm Jeremy Benton. I'm a 2012 HSC program grad. I work for Independence Blue Cross, which is a large Blue Cross Blue Shield plan in Philadelphia. My title is Corporate Development and Innovation Strategist, and I work primarily on internal mergers, acquisitions. We have a venture capital fund that we run, and innovation, which seems to be a buzzword, at least at our company, for process improvement. So that's my roles and responsibilities at Blue Cross. How did my experience at HSC prepare me for my career? I'd say there's 2 big things. The first being, I went straight into my master's degree after undergraduate. My undergraduate degree was in mechanical engineering, so I had not a lot of formal healthcare knowledge or really understanding of how the healthcare system works or where I might want to try and apply my talents. So HSC provided me a solid foundation there. The second thing that it helped me out with was access to individuals and professionals in the industry. My first position at Blue Cross wasn't something that was posted on a job board. I did it purely off of networking through HSC contacts and alumni that I've met through Lehigh.
Well, I graduated just in May, so I have the least experience to say about this. But I totally agree with the 3 panelists here, and in addition to that, I think HSC gives me a great mindset to engineering and analytical thinking that before I don't have. As working engineer, I don't have a specific task or role to work at. But the analytical thinking engineering mindset gives me a chance to pick where I should look at and what to do. And that's the most important thing when you go to a place. You have no information, totally unknown, full of challenges. You know where you can start with.
I'd have to agree with Jeremy and Chase here. Really applying the knowledge and the skills and the abilities that you get from this program have been very beneficial for me in my career. I've always had an idea of thinking broadly and systems thinking and everything, but this program really helps you to use the tools and software and skills to apply systems thinking and really come up with ways to impact in a very measurable way. So I think the KSAs, the knowledge, skills, and abilities that I was able to achieve from this program have benefited me greatly in this career.
Thank you for your insight. Could you please tell us the best recommendations for the transition from graduate school into the working world?
That's a good question. I would say definitely utilizing the skills and the knowledge that you've obtained in this program, because I think that they are really applicable and they are really valuable skills going into the working world. And having that blend between industrial systems engineering and having healthcare, it's a really unique combination and a unique skill set. And I think it's really attractive to employers. So I would say keeping that in mind moving forward. I would also just recommend being flexible, being adaptive, and knowing that although this program has given you a great foundation, there's still a lot to learn and a lot of new skills to develop and build too. It's just kind of keeping that in mind and knowing that this program has given you a lot of great foundational skills, but taking what you've learned in this program and actually being able to apply that moving forward in your career. I would say kind of keeping that in the forefront of your mind.
That was well put. Kind of what I was about to say, so I'll think here for a second. Basically, I think the biggest thing that I would recommend coming out of graduate programs such as Lehigh's HSC program into the working world is go out there with an open mind. I know we're called healthcare systems engineers, but that doesn't mean that you have to always be focused on the healthcare or a healthcare system or even the healthcare field. That's one thing that I think I've learned. I'm working for a healthcare technology firm, and my previous job was a pharmaceutical risk management firm. So it's not necessarily just hospitals, it's not necessarily just medical practices. Think broadly, think open, and as everybody's saying here already with Laura, and I'm sure you'll hear a little bit more, utilize the skills. You guys have a great foundation. It's undoubted you're all very bright. So utilize them, apply them, and keep it open mind as to what you want to do and where you want to go.
I have one other recommendation. Keep your books. They're really helpful moving forward. I've actually gone home over like breaks and things like that. Then I have them like, stored under my bedside table, and I like grab them. And I actually brought them to my apartment to reference them. So I would recommend that. Don't sell these ones. They have a lot of value in them. I didn't maybe see all the time in the program.
Yeah, I think the biggest thing, you all hear me? I think the biggest thing that surprised me when I got into the working world was that healthcare seems to be a consensus-driven industry. So for most of my academic life, I went off, I did my work, it was highly analytical, being a engineering undergrad in the HSC program. And I'd come back and I'd present my recommendation or my project to the professors or take a test, and I'd get a grade. In the working world, it doesn't necessarily work like that. You're often going to have to build political capital with your colleagues. You're going to have a lot of meetings to drive consensus. So I think that's probably the biggest change that I encountered from the academic world at Lehigh into the professional world.
I as the student just got into the business, I'm still in transition, I'd say. And from that perspective, I'd say I agree with Jeremy. Things will be like you have to learn and keep the learning in your mind while you practice and have the meetings, do the works. So even it's something you're not familiar with, you can learn it like in split second. And I believe with the skills and what you learned in our HSC program, you can basically master everything of engineering, if you like.
And I'd agree with what everybody says. Kind of sucks being at the end of it, but whatever. I will say that two big things I would say is in your courses, if you spend a lot of time hitting the books, studying, applying different things, take that to the working world. Don't be afraid to ask questions with your predecessors and other individuals. But in addition to that, stay hungry. Make sure that the things that you're doing, you're enjoying, and that you showcase that you're enjoying the work and that you're going to continue to do the best of your ability when you're doing an item or a project or delivering a result. Others will see that, and that will reflect well on you as well as the program. So.
Thank you. And the last question before we open the floor for discussion with everyone is, what trends can you predict with regards to the healthcare system over the next 5 to 10 years?
I think there's going to be a lot of trends. Some of the things that I'm seeing is just a more integrated network of just healthcare providers, payers. Things are becoming a little bit more consolidated. We've seen a lot of mergers and acquisitions in the market. We're also seeing a lot of digitalization. So a lot of digitalization of just healthcare information and using mobile technology, using really just becoming I think information sharing and being able to do that easily and quickly. I think our generation, we like information quickly and we like it now. And I think that is going to kind of flow over into the healthcare industry and become more of a demand from a consumer. So I'd say digitalization of healthcare and consolidation and creating a more integrated network of healthcare players.
So just to add on to that, I think the integrated network is a key point. I think the biggest point around an integrated network is going to be the value-based medicine and the value-based reimbursements that are going to be coming up. Mm-hmm. So how do we as engineers and healthcare systems engineers fit into that mold? And I think that's a perfect niche for folks like yourselves, the folks sitting up here. You understand both ends of the spectrum. You understand what's at stake. You understand the risks. And you're really good at solutioning and doing the analytics behind it. So I think that right there, I think, is going to be the key point for folks that are, you guys coming up and those that are going to be coming in behind you.
Yeah, so I think value-based care, definitely. I know Independence, as we renegotiate all of our contracts with our major providers, we are working on focusing on value-based care and what exactly that means moving forward in a payer-provider world or even in an integrated world where payers and providers are the same entity. The next major trend is probably commercialization or consumerization. So health insurers are beginning to introduce what they call high deductible health plans. I'm sure you guys have studied that a little bit in your classes. But in succinctly, they're plans where you have to pay $5,000, $10,000 out of pocket before your health insurance kicks in. The thought being that consumers are going to be much more invested in making healthcare decisions if they are able to, or they're receiving some of that financial burden up front. So I think that's another big trend. And yeah, working on the connectivity between healthcare institutions. So how do they share data? What do they do with the data? Do you have analytics? Well, you've generated a lot of lists with your analytics. How are you going to actually make meaningful interventions with those lists of people?
Yeah, as a new graduated student, I'd say, I will just say what I saw. I saw massive data analysis using in healthcare industry, and it's gonna keep becoming more and more popular, I believe, in 5 or 10 years. And people are trying to solve the problems with technology applications. Like in the past weekend, I took part in healthcare hackathon in Thomas Jefferson. They were trying to make changes to healthcare using drones, using wearable devices, trying what they can to reduce hospital readmissions. And the good news is me and the Lehigh team, we won the 3rd place using drones. And with technology or data analysis or business management analysis, there are a lot of engineering in it. So you guys have a bright future. Just go for it.
To reiterate what others were saying, payment and information. Payment on how healthcare is delivered and how that will impact the healthcare delivery world right now and how it's continuing down the future path. And information on who's managing what information to make whatever insights or actions. So whether it's going to be the consumers, whether it's going to be the payers and providers working collectively together in different ways, alternative approaches will be investigated, researched, analyzed, and determined as to what's going to be the next thing. So the big levels, like everybody said, payment and information are the key things to continue to watch.
Thank you. We now like to open up the floor to questions from the audience. So is anyone ready to ask anything? Anyone? All right, Mr. Pass.
Good to see you guys. So, if from the perspective of the current jobs you have, you had an opportunity to talk to national policymakers on healthcare, what advice would you be giving them about where we need to go from where we are?
So you start with the hardest question, right? I'll take a stab at it. I'll take a stab at it, I guess. Broader thinking. I've already mentioned this before, systems thinking, and applying it here is the best thing you can do. I would say broader thinking in terms of policy, in terms of how we operate now, and making sure that we're doing the research behind everything and activities that are going forward to the best of our abilities to make sure the things that we are moving forward with work well and they're sustainable. So I would say broader thinking in their approaches to many different avenues.
I think my take on this would be to bring together a multidisciplinary team. I think that's going to be key. I think a lot of policymakers are driven by politics or agendas, obviously. And I think the key behind that is to get a group of not multidisciplinary, but folks at different work streams essentially together to actually develop and build the policy. I think that sometimes they're happening in silos and they come together downstream. I think that has to happen upstream. If I had to kind of sit down with people.
I'd probably say mandatory price transparency. So recently, I think last year, CMS released all of the reimbursement rates that they pay out to a number of providers across the nation. So you have price transparency from the government standpoint, but on the private side of the business, there's tremendous price variance from one institution to another. And there's a lot of arguments that are going to be made that, hey, there's a quality differential between institutions, and that's why there's a price differential. But we're seeing, at least on the payer side, that there isn't always as much of a quality delta as there is of a price delta. So making that market more transparent, the price market more transparent, I think can only improve a number of pressures already in the healthcare system to help improve cost and quality.
I think those are all really great recommendations for our legislation. I also think that just ensuring sustainability, I think that we need to ensure that the changes that are moving forward and things that we're putting into place are going to be sustainable for long term, to cut costs in our industry and to really kind of increase access and improve quality, kind of all of the things that the government intends to do, just ensuring that what they're putting in place is actually achieving those objectives for the long term, and that they're sustainable changes that will improve our healthcare system, just in general.
Yeah. I would make a comment on Chris' answer. Maybe we could do not only multidisciplinary work together. We can do. We can have people from different industry working together, like from media, technology. We need the whole society to work to solve this healthcare issue, not only by healthcare on its own. So from media, we get a better chance to educate the patient, maybe. Technology, we use more than advanced device, software technology. Those are all, basically we need everyone's support, not only healthcare.
Great, thank you. That was a great question, Mr. Paxton. Does anyone else in the audience have a question?
Just a note, that question might be on your final. That question might be on your final, I said.
Omni.
First of all, thank you for sharing your thoughts with us. My question is, with the trends that you mentioned before, I was wondering what changes do you think, or do you see it having an impact on your company, and what foreseeable changes do you think your company will undertake to embrace these changes or embrace these trends?
Yeah, I can go first if that's okay with everyone. Yeah, so from the health insurer perspective, I think the biggest thing is you're becoming moving from a B2B business, so selling to other businesses, selling to a Comcast or the employer groups, to selling directly to consumers. So our company went through a transformation back in 2013, 2014. They developed a whole consumer marketing business line segment, and they added, I think, 150 to 200 staff focused solely on marketing and developing relationships with the end consumer of healthcare or the individuals. So that's been a big change for Independence moving forward. Another area that we're seeing tremendous shift is in the rate negotiation for some of our contracts. So in our individual markets, we now have to submit price increases to a number of regulatory entities. So when we want to make a 5, 10, 15% price increase from year to year, we have to justify that somehow. And we're receiving pushback from the regulators on that. So there's been a lot more diligence in our contracting process with various providers, and we're also deploying a more broad swath of strategies, such as narrow networks. We're starting to experiment with educating some of our doctors on, hey, we realize you guys might be referring to your best friend, or you might be referring to this guy that you've known and he does great work for the last 20 years, but did you know that he actually happens to be the most expensive heart doctor in our network? And if you refer to this guy, well, maybe he's a little bit cheaper for us, but if you look at his results, he has no difference in his quality of operations or his quality of care.
So just to follow on to that, being a tech firm, our job is to execute on everything he just said. So basically help the consumer or the end user have that information at the point of care in real time. So really what we try to focus on is giving that information, making that transparent and available, as I said, at the point of care or right at the end user availability.
And I would say, being in consulting, a lot of the time our job is going in and helping different organizations who are looking at these trends in the market and really working with them to figure out how they're going to act on these changes and how they're going to plan strategically and help them facilitate actually implementing these changes so that they have a good strategy and that they have a good position in the markets, that they are relevant and that they can provide the best care to their patients and to their communities. So I think that really just ensuring that we have people on our teams that are knowledgeable and have expertise in these areas of where healthcare is changing and where these trends are. I think that we'll be definitely position ourselves to ensure that we have the appropriate teams to help different healthcare organizations execute on all of the different changes in the system. We also have a health research institute, and they produce a lot of great thought leadership on a lot of the changes that are going on in the market. And I think that just staying on top of these trends and really analyzing them and figuring out where they're going is something that we are staying very on top of.
Yeah, I just had a talk with Chris during the lunch. I'm working on a proposal for the company, trying to bundle Laura with Chris together and sell to the client. Yeah, one side is the data analysis product we're having, and on the other side, the bundled service is a consulting service we provide to our client as a specialist of our product. So by doing that, we can have follow-up specialists at the client place and keep the client using our data analysis product.
I'll say from the hospital perspective, two things. One, it's managing and weathering the storm of all the changes taking place that are disrupting healthcare that's been going one direction for a very long period of time. And then the second piece is, after you've been able to weather that storm, partnering with all the organizations that we're talking about here and finding ways to improve on the places that you were performing unsuccessful, not just clinically, but maybe financially or administratively. So it's kind of a weathering the storm and then coming back with more actionable work and items to help improve not just your bottom line, but your high quality care and reaching that triple aim that we're all talking about.
Thank you. Any other questions?
What's one skill that you wish you learned while in the program that ended up being pretty important in your job?
Excel. I would say being proficient in Excel and learning how to look at big data and how to analyze it and detect trends and figure out how to model it so you can change different inputs. That's something that I have learned a lot on the job and I've found to be a very essential skill in my day-to-day responsibilities. So I would say becoming familiar with Excel, all of its functions and all of its capabilities prior to entering the working world would be very beneficial.
Sure. I'm still thinking. Yeah. I think that a bigger emphasis on presentation and talking and challenging assumptions in the healthcare system would probably be beneficial. My job is very social, so I often find myself going through a process that we call socialization of concepts. So I have to talk to maybe 3 different directors, a vice president, and 2 managers to see if a project even has legs. Coming from an engineering background, I was used to getting the problem, going back to my dorm room or my library or my computer and doing the analysis, and then coming up with the answer. Now I find that the answer isn't always something that I can see from the beginning, and it might be something that I'm never going to get to on my own. I'm only going to get the right answer, if you will, by speaking with a number of different stakeholders. So I think the ability to speak fluently and to have a command of healthcare vocabulary is important.
Absolutely. I would agree completely with Jeremy. The soft skills will take you a long ways in any organization, especially when you're dealing with many different stakeholders across any environment in healthcare. Being able to apply and be involved in taking part in a lot of different presentations and public speaking events and activities to that nature will only improve your drive when you're in the room with those other stakeholders and big names and officials that are needing to have a clear understanding of the goal at the end of the table or the value proposition behind what you're doing. Having those soft skills and being able to present them fluently, like Jeremy said, will take you a very long ways.
I think having a better understanding of what's in the current marketplace while I was at the program, I think we're so focused on getting your schoolwork done and getting your coursework and your tests, and you're just looking for the next paper to get done, that you lose sight of what's happening currently in the market and how it's going to impact you. As you guys are asking these questions today, how it's going to impact you once you're either out of the program or 5 years into your career, that insight I think would be best to have within the program itself, built in somewhere.
Absolutely, I agree, yeah. It changes monthly.
Yeah.
You know, the pace of
Exactly.
change is unbelievable right now.
I mean, any world event's going to change the healthcare system. It's all tied together. So, changing of regimes to anything as simple as Independence Blue Cross doing something new.
Okay, to me, I'm a more technical person, so I'd say analysis. So not only one software, one math problem solving, it's like the whole system of analysis, analytical thinking. That helped me to do what's called evidence-based decision making. So you make decisions after the program scientifically. That's the one I want to learn the best.
What type of programs do you work with?
Now?
Yeah, or languages. Because SQL is big for us, a lot of SQL queries, lots of SAS work.
SAS.
SAS?
SAS.
Yeah, SAS is big for us.
Those
I think
two
the
things.
most popular one. I don't know.
I've learned if you're a guru at SQL, you can pretty much get a job anywhere in the world. So.
Great, thank you. Any other questions?
So lots of different schools offer like health administration and health management programs. How do you find in your day-to-day the engineering perspective is beneficial?
Anybody else?
Yeah,
Oh,
you can go,
you
I
got
can
it?
go. You can go.
Go ahead, Phil. You always last.
Yeah.
Thank you. Having had a master's in healthcare administration as well, I can answer that from a different perspective. This program, being focused on the analytical side, is key. Most professionals in the healthcare industry you'll see don't have that skill set as you will have coming out of the program or being able to apply it. They'll come from the background where they understand the definitions, they understand the trends, they understand what's going on in healthcare from what they're told from others, but if they're asked to use or apply anything in terms of research or how to find the real meaning of a metric and where it's going with whatever deliverable, they're not able to do it as skilled as individuals that have that analytical background. So this is, computer science, a good area as well. This area gives you that understanding and the depth that you'll need to apply on the operational level in different stakeholder environments. So.
No, I agree. I think that a lot of people, with Masters of Public Health or public health undergrad degrees, operate from what they would view as a set universe of models of care and models of how the healthcare system should work. Whereas with the engineering background, I find myself operating more from a frame of how do I create a structure or a system that works to my needs, not, hey, I have these 10 different models and I'll just pick the best one for this given situation. Which is, it's a nuance, but definitely something I notice when I work with people with NPHs.
Yeah, and I have to, just to build on that, I think the biggest question that engineers ask is why. I think a lot of folks
Absolutely.
who aren't from that kind of a background, that analytical background, do not tend to ask why. They tend to choose from a standard set of solutions or a standard set of data that's out there. But you all and engineers in general tend to ask, why am I doing this? What's my end goal? And am I going to achieve it by making this selection?
Yeah, I agree with everything that the panelists have said. One thing that I also put a lot of emphasis on in my job is efficiency, working smarter, not necessarily working harder. And looking at something and it's like, what is the most efficient way that I can complete this process to give me the results that I want? So I would say definitely looking at efficiency, not even just in what you're doing, but the efficiency of the processes that are going on around you, and seeing how you can improve those and where you have opportunities to reduce waste within your team, within the work that you're doing for the clients. Just in general, that's one thing that I feel like I've been able to get a lot of value out of having that engineering background. Looking, like, for example, even in optimization, looking at, in simulation, for my project, we modeled patient flow through an emergency room. We looked at resource utilization and things like that. So being able to take those skills that you learned in the classroom and really apply them to what you're doing, I think, has been beneficial. And I think that's something that's very unique to this program, having that engineering aspect that maybe people who in a different master's program might not get that same value.
I was shocked when I first went to Independence how much reliance we had on just trial and error approaches from business analysts. You talk about patient flow. From what I've seen in industry, a lot of the times when people think about issues like that, they'll say, hey, my gut tells me it should be 5 doctors on call Friday night because that's what it's been for the last 4 or 5 years. There hasn't been the level of rigor that I was taught during some of my simulation classes, some of my optimization classes. And it floored me, to be frank, when I first got into industry, that people are operating at that level of sophistication.
Yeah.
Yeah, you basically covered everything. Yeah.
Thank you. That was a great question. Anyone else?
So now that you've graduated, you've been out there, what advice would you have for the HSE program in terms of, in a changing world, topic areas we don't address in the program today that maybe we should give consideration to?
I think one of the panelists had touched on this, but I think that in the courses that we have, I think that there's a lot of emphasis on, or I should say that we are very focused on our books and our studies, but I think having that exposure to what's going on and what's changing in healthcare and having almost like current events of healthcare to keep up with legislation, because it changes so quickly. Things that are going on in healthcare, it changes by the day. So having something that keeps up to date on kind of the current trends in healthcare instead of just looking at it from a more broad perspective, I think that's something that would be helpful and beneficial from my perspective.
I agree. I think that's very much what I was saying earlier too. I think just having that ability to analyze what's going on today, how does it impact us going into the future, and then how can I change the impact or change that solution downstream. As you guys are going through your coursework, I think it's imperative that you are able to correlate what you're doing on a day-to-day basis in the books to what's happening in today's world. As Jeremy was saying, in simulations, I was learning about how to code and how to do all this great stuff with simulations, and I knew everything that would happen in the ER, but I never sat back to think about what's the impact of having only one physician on call versus the normal 5, until you actually think about how does it affect the model, right? So just correlating what's going on day to day. We're talking about value-based care. I hope all of you understand what value-based care is at this point. If you don't, look it up. But that's going to be a huge up-and-coming buzzword. As Jeremy was talking about innovation being a buzzword, I think value-based care is going to be a big buzzword. And understanding really the ins and outs of it, where is it going, where are policymakers taking it, how are the hospitals adapting to accommodate for it, and then obviously the payers, which I'm sure Jeremy has more to add to that piece. But I think that's really critical.
Yeah. For a little background knowledge for y'all, Independence Health Group has about $16 billion in revenue, and to support the organization, we have an informatics group of about 180 individuals, and they spend a lot of their time generating internal reports for our customers, but they also have what they call an advanced analytics team. And this advanced analytics team works using what they call machine learning to develop a lot of algorithms internally to figure out, hey, some of our members might be experiencing difficulty. They call our call center representatives, they take down keywords into the computer system. Is there a a model of keyword recognition that we can deploy that'll identify members who are most upset or most unhappy with the healthcare they're receiving from Independence. We also have a lot of informatics folks working on what they call disease prediction. So we have, I think, I won't give a specific number because it's going to be wrong if I make it up here, but we have a high number of members with chronic conditions. One of the biggest ones for us is diabetes. So we have a number of patients that we believe are pre-diabetic, but they actually have, they're classified right now as being pre-diabetic, but we believe they actually have diabetes. So we have all their healthcare claims information. Is there a way that we can come up with a number of algorithms using machine learning to figure out, hey, based upon all these data points and what we've seen in the past, it looks like these 200 members who are pre-diabetic right now actually have diabetes, and we should send a note to their primary care physician or send a note to them saying, why don't you go get checked out because you may have a condition that's not currently diagnosed.
So I think to kind of summarize what Jeremy was trying to say, no, I'm joking. But I think what I'm taking away from what Jeremy's thinking is something that we did in medical school a lot. It was actually case-based learning. So maybe it's a potential thought for the future is actually develop situations, problems, and actually learn your curricula based on a given situation. So in Jeremy's instance, it was how do we determine who's pre-diabetic and what the algorithms are going to get there. How am I going to achieve that using the skills that I'm learning throughout and utilizing those skills simultaneously would be kind of an interesting thought.
Well, I think machine learning is certainly a set of techniques that's taught at a number of universities, including Lehigh, I believe. So I think just making the curriculum here more robust in that particular skill set. So we do a lot of optimization work. I remember that from the undergrad program or from the graduate program, but not a lot of the machine learning work.
I think partnering with the other institutions around us that are doing these kind of activities, these other entities, other disciplines here at Lehigh, in ways of all this data flowing around, all these questions flying around. Just take a stab at a lot of it. Let's find some more answers. Let's see where we can partner and engage with others, and just let's explore a lot of different these opportunities that exist or may not exist yet, that have questions already that we can take a stab at trying to find a solution to, or a number of solutions to. I think the idea behind partnering and engaging others is a great opportunity here for the HSE program.
Well, I think the most important thing is make your mind actively looking for challenges and knowledge, and find your path. You know where you're going, and along to the when you're going for the path, you're actively seeking for information, both inside in our program or out of our program. In that way, I think you will get a better understanding of the engineering and healthcare industry.
Great, thank you. So I have another question for you. Could you please talk about the capstone project that you worked on, maybe how you found the project and how it's helped you in your careers?
Sure. As I mentioned, I had worked with Lehigh Valley Health Network, and I worked with them on helping to kind of understand the status of their organizational changes. They were transitioning from primary care settings into patient-centered medical homes that were NCQA certified. So I was working actually with their practice change managers and analyzing data that they were collecting from their time in the primary care settings, and I was also conducting interviews with the Lehigh Valley Health Network administration to get information just from a couple of different sources to see really where the network stood on this change, because it really is a really big cultural change for the network. So my job was sort of to analyze data and information from different sources and pull it into one really cohesive report that they could use moving forward to see where they stand and where they maybe have gaps towards this change. How I found mine, I think I got introduced to someone at the network, and then I was telling them about my interest, and they said I should speak to someone. They're like, oh, we have a project that we want to do. Let's pull you on board. Her name was Kathy Coyne. She was great. I really enjoyed working with her. I forget who it was that originally made the connection, but it was just sort of networking, talking to people about your interests, and they say, I have a great person to talk to, so networking really that's how I got my capstone.
Thanks.
My capstone was with the Navy Bureau of Medicine and Surgery down in D.C. It was an interesting, very interesting group. It was about 6 industrial engineers. I was the one healthcare systems engineer that came to the group. Basically, they were tasked with providing all optimization and efficiency solutions for the entire Navy and all their naval hospitals around the world. And I worked on many small projects when I was there. I think the biggest one we worked on was a very interesting one. Basically, our job was to determine the optimal resourcing from physicians and nurses that were needed to help deliver babies at all the hospitals. And there's a direct correlation between leave time, obviously, for your service members, and 9 months later, you're generally going to have a ramp up in your resourcing at these hospitals. But in between, you wouldn't need those resources. So what would we do to deploy them to make them optimally efficient and not just basically waiting for work? So it was a very interesting project, and I think the experience I got there was through networking. I don't know how I met Tim. Tim Ward was the director of BUMED at the time. I want to say I met him at a Lehigh alumni event, but they also advertise a lot on blogs for open positions. I still get emails from them saying we have an open position and things like that. So they're very, obviously out there in the market, but again, it comes down to networking. Lehigh, I think in general, has done an excellent job in bringing in industry leaders and experts. So if you all don't take advantage of that, that's your loss at that point. So take advantage and really get out there.
Yeah, my capstone project wasn't necessarily such an engineering focus, but Independence was selling a lot of Medigap plans, so it's similar to Medicare Advantage, and they didn't necessarily have the resources in order to service that. So my project was to help do a request for price on a Medicare TPA company, a third-party administrator. So this would be an entity that does the call center, that does the enrollment, that does a lot of the legwork around servicing Medigap plans. I got that project through networking with some of the HSC, I think it's the advisory panel. The gentleman's name was Brian Lobley. He's at Independence Blue Cross. Ooh, excuse me, Independence Blue Cross. Just a point about getting a job coming out of the HSC program. I think healthcare is a little bit nascent in their recruiting efforts. So some large engineering firms, a lot of the professional services firms, they'll take in a class every year of 100, 200, 300 people, and they go out to universities and really pound the pavement to get those applications. Healthcare, you're dealing with a lot of entities that might not have as robust a recruiting effort, so it's really going to come down to networking, reaching out to people, trying to get those second and third degree connections as far as getting your first job.
My capstone project was with Coordinated Health, working on a cardiac clearance scheduling problem. That's where I learned soft skills really values a lot. It was kind of funny because I was there, introduced myself as I'm here to do some system engineering and process improvement for clearance scheduling. So then I was assumed naturally as an IT guy to fix their EMR problem. I don't know why. But then I pretended to be the IT guy.
It's a good strategy.
Yeah. Collect their complaints about EMR. But while I was doing that, I found the communication mistakes, communication problems, and then misscheduling. It was fun. And they still remember me. If you go back to, if you all have a project in those 8 weeks, we were like a family. We have lunch together, spend whole day together, and if you go back to the Coordinated Health cardiology center at Cinder Street, Bethlehem, tell me Chase say hi.
Actually, I had a local project, and Stewart, Professor Paxton, set it up, which was great. It was the Neighborhood Lehigh Valley Super Utilizers Partnership. and might be future capstones available, so I would definitely advise you guys to take a look at it. They asked me to evaluate their processes, their mapping, everything going on with their organization, and then really, a really interesting part, validate them. Were they meeting the needs of their community? Were they able to find a sustainable funding infrastructure? Kind of really evaluate their entire world, essentially, which is not a very big world, but they're doing some good work locally. So it was a lot of fun. I did a lot of mapping, did a lot of process improvement, did some data validation in a lot of different cases. And what we end up coming down to as a solution was that they have a ways to go, at least in terms of becoming a valuable infrastructure for Lehigh Valley and future partnerships with other organizations here locally. So it was really interesting because it was a sort of a project that nobody had really been able to do for them yet. But at the same time, I was able to practice a lot of the tools and skills that I learned from the program.
Great, thank you. Okay, go ahead.
So if you consider your accomplishments, how much of your success might you attribute to your Lehigh education, and how much might you attribute to your HSE degree?
So the position I have now wasn't something that I found on a job posting, and it wasn't a position that existed before I came to Independence Blue Cross. I don't know if I mentioned this, but the way I got there was purely from networking, and with Brian Mobley, who's an HSE program advisor. So I think if I didn't take or didn't get the HSE degree and come to Lehigh, I wouldn't have my position now at all. I don't know that it would exist for the company.
For me, I would say that, I had a more liberal arts undergraduate education. I was seeking out having a more technical graduate program to sort of balance out my undergraduate degree that was a little bit more liberal arts focused. I developed an interest in healthcare through my undergraduate studies from the Health Medicine and Society minor program, and I was really looking on a way to kind of increase my education in healthcare, and I just developed a really strong interest in healthcare and the business side of healthcare and eventually consulting, and I think that the healthcare systems engineering program really prepared me well for that sort of position. So I would attribute a lot of where I am in my position today to the healthcare systems engineering program, because I think that it gave me a lot of great skills that are really attractive to employers. So I would say a decent amount of the healthcare program.
Yeah, I'd have to agree with that. I came from a very deep healthcare background, and having gone to medical school and practiced a little bit of medicine, and then coming out here, not as long as Terry Thiemann, but definitely, I think one of the big things that I took away and still take away from the HSE program is my ability to leverage what I've learned in the HSE program and leverage the degree itself. I was speaking to Dr. Terlaki earlier. And I think one of the cool things about being an HSC graduate is I'm always asked, what are these letters after your name, and what does that exactly mean? And I can make it what I want almost. Basically, I've worked in pharma consulting in a the pharmaceutical industry. I've done operations consulting in the healthcare industry. I'm working with a technology firm now. So I've done a lot of different things, and I attribute that from the items that I've learned or the different aspects I've learned throughout the HSE program itself. And they've given me the number one, the credibility. I think coming from Lehigh and saying I've got an engineering and healthcare systems engineering degree is number one, it's a huge ear perk for most people. And then number two, actually utilizing those skills and being able to leverage them has been really beneficial to me.
When it comes to what the program contribute to my career, I'd like to start with my background. My background is electronic engineering, which is building radar and missiles, which kills people. And if I didn't join the program first, I won't be in the industry. Probably I'm somewhere developing missiles killing people, but I don't know. And within 2 years master program, I learned processes, analysis, and all kinds of skills, and it totally changed my mind of how to look at the world, how to solve problems, making decisions. So I think like, I would say I can get to this point is mostly all because of the healthcare system engineering program.
I'd say my background qualified me for the position I'm in now, and the HSC program connected me to the right location. Martin, who I mentioned at the very beginning in the back of the room, is actually on the board and has been active with the board and very interested in this program. Maybe hadn't connected where HAP would get involved, but regardless, I've been a fortunate piece of that opportunity. I think where healthcare is going allowed Martin to see, and as well as the rest of the senior team, see that there is a need for a bigger picture thinking in terms of with policy, with operations and healthcare delivery. And so it really said, you know what, let's take a stab at working with an HSC student, take him out of there. He's got the good enough he's got a well enough background in education and experience. Let's give it a shot. And so far it's been a really good blessing. So I think HSC was a good connection point. It opened up a lot of opportunities for me and to find the right one.
Great, thank you. Any other questions? No? Oh, okay.
Thank you for all of you. And I would like to know in which part of your job you can gain a sense of achievement, or say which is your favorite part in your job.
So favorite part of our job and what gives us a sense of achievement? Yep. Oh, okay. Go ahead. No, go ahead, Phil.
Favorite part of my job is that it's very fast-paced, and then 1 minute it may slow down for me to catch up on work, but you never know what's going on in terms of being in policy and policy development and healthcare delivery. It's a really weird dynamic, but it's always learning, you're always active, and you never know exactly what you're going to be doing the next week. For me, that's been a lot of fun. It's been a real pleasure to be involved. I'd say, I guess, yeah. What I enjoy most about doing the job is not just the adversity of it, but the connecting the dots. So understanding the policy, applying what's going on right now in healthcare, and trying to get a strong sense of what's going to be taking place in the future, forecasting and whatnot, is really a treasure because you're in a point of advisory to provide guidance, for me, at least for the hospitals and for our internal staff and for others and policymakers, based off of what you understand and based off of the data-driven research you've done, to be able to assess and say, look, this is what's going on. Here's what, if you're going to make a strong decision, here's what you need to understand your environment. You need to understand what's taking place and what's coming down the pipeline with policy. So being able to connect the dots and share with others and advise others has been a lot of fun for me.
To me, I think when you get valuable information from those data figures, from those data points, and you provide your customer valuable information, valuable recommendations, make changes. It's simple, you help people and you feel good.
I think the favorite part of my job is that my role and responsibility isn't strongly defined, so I'm able to act as an internal consultant to the company and work in a number of different areas. I also am able to step back and have enough organizational view, like across the organization, to see change happening. So, some projects might be very difficult or even impossible to move forward, but those that do move forward, you actually get to see some of the impact that you're making on the organization and on the healthcare of some of our members. Because at the end of the day, you are affecting the way people live their lives and their health, which is probably one of the most, if not the most important thing to them.
Yeah, and to echo that, I think working in technology, I think it's just fun. There's a lot of new things, there's a lot of innovation. Our software developer, their whole team, basically, their motto is anything is possible. So it's always fun because we always throw them new ideas and new things and challenge them to do and come up with these new innovative ways of approaching medicine for these patients. And what Jeremy said last was really the most highly rewarding piece. Having stepped away from medicine from the clinical aspect, I feel like I'm actually impacting more patients with the work that I've been doing and am doing from where I'm sitting now. So that to me is one of the greatest things to take away.
Yeah, one of the things I really like about my job is feeling like I have a strong impact on the organizations that I work with. I feel like the work that we do has meaning, and I can see that what we're doing is has value. So I really think that's something that I enjoy. I also enjoy that it's very fast-paced. With consulting, you're on one project one day, you could be on something completely different the next. So I feel like I'm continually learning, and I'm learning among really great and really smart people. So I really enjoy that.
Great, thank you. Any other questions from the audience? I have another question for you. Could you please describe to me your typical workday? I know it's going to be different across the board.
Sure. Well, if it's a Monday, I'm usually getting on a plane. 'Cause in consulting, you travel usually to where your client is. From January up until just a couple weeks ago, I was traveling to Rosemont, Illinois every week, which is right outside of Chicago. So usually Monday morning, getting on a plane, going right to the client, meeting with my team, kind of regrouping on where we stand for the day, talking about what our goals are and where we stand, and just sort of dividing up the responsibilities of what we need to get done. It really depends on the week. One thing that I learned in consulting is it depends is a very common and popular phrase, just because a lot of what you do does depend on the situation that you're in and the problem that you're facing. So I say every day is somewhat different, but working really closely with my team, figuring out what our goals are and figuring out how we are going to execute on those.
Yeah, so my days are very varied to that effect. If we do have a client that we're working with directly, we're on site, we're working with them, we're developing a solution with them. Otherwise, we're fairly a virtual company, so we do have folks all over the country. Our software development team is actually based out of Romania, so we have to get all of our stuff in before I go to sleep so they can work while we sleep, which is kind of fun to work with. It's nice when you wake up, everything's done. But I think it's a neat concept. It's a challenge though too, working remotely and working virtually. There's a lot of learning around that to manage your days and manage your times, and actually setting boundaries. So it's an interesting day for me sometimes, and other days it's been, I'm in Laura's shoes where I'm traveling to client sites and working with actual hospital sites and getting them set up.
Yeah. My days are fairly varied, but I think I can break it down in terms of percentage of time spent doing certain tasks. So I would say a good 20% of my day or so is spent thinking about, is this the correct path forward? What's the best way to frame this for discussion? Who do I need to talk to? What are the key individuals that I would need to get on board for a certain project to move forward? I think a good 30% of my day is spent doing some sort of analysis or constructing a PowerPoint document. So the analysis probably in Excel, whether it's financial or some sort of insights that we're trying to glean from data that we have from our claims database. The remaining 50% is probably split evenly in hearing new ideas and concepts from outside companies and talking with folks in meetings internal to Independence Blue Cross on some of these concepts and projects we're trying to move forward.
Yeah, my days varies also by tasks. So if I'm doing tasks for the vendors and the contractors, I usually have a morning meeting at 7 or 8 because we have vendors from India. So we're kind of have to fix that time zone problem. And after that, I would do collecting the state of works, invoices, document them, and having meetings present my beautiful flow charts about our processes working with contractors, saying, okay, this is not good enough, we have to improve this, and get all the data points for different hours spent on different projects, and the utilization for different contractors, trying to get them better utilized. If I work with a client, I will be working as a part of a data team. I get data, analyze the data, and feed it back to our implementation team so they can give a better information to our clients.
just like what Laura said and everybody else, it depends. What's going on in the world, what's going on across the healthcare delivery spectrum that we get involved with and provide that ideas, insights, and research for hospitals, health systems, and whatnot. So 1 week it'll be studying the latest Stage 3 meaningful use rules that came out and providing insights to our members on what to expect, what to be worried about. The next week it could be looking at models that were provided that we looked at, had to analyze in, then reflect back on to membership who call with questions and concerns about how it's going to impact them later. The next day it could be focused on the challenges with the budget that's going on right now that we still don't have, that is, and how it's going to impact our hospital communities. It's really about what's going to come down the pipeline in terms of impact across the communities. We address what that is as best we can and continue to provide guidance to the best of our ability. So.
Great, thank you. We would like to thank all of our panelists for providing your experiences and thoughts about all the questions we asked you. Please do stay after and network with the Industry Advisory Council members and the panelists as well. There's going to be some light refreshments in the back, and thank you all for coming.